I just want to just reset the room again because we now have with us one of the other panelists, Dr. Monica Alabi. She's also known as Simi Alabi, and she would also be answering some of the questions tonight. We're recording the session. This event is being run by AfroGPHertsandBeds, and it's a question and answer session on COVID-19 vaccine concerns. So I'm going to direct a question to Dr. Simi Alabi as she's here with us right now. My first question to you is, if I already had COVID-19 and recovered, should I get vaccinated?
Great. Thank you again for putting this together. AfroGPHertsandBeds and Hertz. Well done. Amazing. I'm very proud to be here. Yes, I think the question is around natural immunity and vaccine immunity. I think this person is trying to ask. So yes, you should get it because yes, you might have some natural immunity, but we cannot tell to what extent the natural immunity is. There's been various studies on whether your immunity lasts longer the more severe your disease is, or if you have a mild form, whether it wouldn't be very good. So, but that's all just us still studying the long-term effects of COVID-19. However, what is sure is that in most people with the vaccine is that you would have protection against severe disease. So if you've had COVID, as far as you're out of your 28-day period, then please go ahead and get your vaccine, and you will be protected against any reinfection should that occur.
Wonderful. Thank you so much. Were Black and Asians involved in the clinical trials?
I will speak about that because I have had discussions with people, with one of the principal investigators in the Pfizer trial. I think during our discussion, I think it was Dr. Alozie who said something to the effect that we don't take part in trials. We don't. I'm just saying this now. We don't donate blood. We're not. We don't donate our organs. So we, as Black and Asian people, tend not to be involved in this. But when it came to COVID, Pfizer went out of its way to ensure they recruited people of color into the trials. And like Dr. Alozie has said, some trials were done in South Africa, some were done in South America, so that people will not say, oh, it was only done on Caucasians. In the Pfizer trial, I think up to about 10% of the 40,000 people that took part in that trial were from the BAME community. So the trial was conducted using Black people as well. So there's no one vaccine for Black or one vaccine for white people. Yes, we were part of the trial. Perhaps not enough of us took part in the trial, but at least representative enough to show that it works and it's safe in Black people.
Thank you so much. Does anybody else want to add any more to that?
To add something really briefly to that, which is just following on from that and about encouraging either us or our family or friends to take part in trials going forward. I know in this case we had everybody mobilizing to get people involved, but ongoing, and particularly as we looking at trials and developing vaccines on the continent of Africa, that we all need to get involved with putting ourselves forward for the trials and for other things as well. So yes, it's a call to action that in the future we also need to get involved more with other vaccines, not just when it comes to a pandemic.
Fantastic, thank you. I totally agree with that. That the more we put ourselves forward, the more the treatment or the vaccines we can trust that they're applicable to us because we know that it's being applied to our community. Thank you for adding that in. I've got another question, and we've got quite a few questions still, and I'm mindful of the time, so I'm just going to quickly ask them so that we can then sort of do a summary and everyone can just do a little bit of a little take-home message. So the questions at the moment is around the conspiracy theories, and one of the questions is around the vaccine being the mark of the beast. Who would like to answer that question? Is it the mark of the beast?
In all honesty, there's no truth in it. I know that, people come up with all sorts of with all sorts of no, they're not even theories, they're hypotheses. People just make up things, and sometimes I think that there is a lot of misinformation. There's a lot of disinformation. So not just wrong things. Things that may have a little bit of truth, but you're not too sure. There is nothing like the mark of the beast. It doesn't exist, and it really is not in any of the vaccinations. So please, if that's your hesitancy for getting the vaccine, I would really, really encourage you that there is nothing like the mark of the beast. Everything in the vaccination, in all of the vaccines are clearly written out. There is no component called mark of the beast in any of them. So please, go ahead and get your vaccination.
Thank you for that. Let me just add to that. The mark of the beast is supposed to be on the forehead and on the right hand. I think when you go, nobody has given the vaccine on the forehead, and you have a choice as to when you go for your vaccines, they ask you which hand you want to have your vaccine inserted. And really, it's even in the shoulder. I could argue that in biblical terms, when it says the right hand, they're probably talking of the hand or the forearm or the arm rather than your shoulder. So there's nothing like the mark of the beast. We have also spoken to religious leaders, both faiths, Christian, Muslim, Jews. There's nothing like that. I think what people are doing is to raise, they appeal to what will cause panic in human beings. And we've been told that we will not have the spirit of fear. And what people are trying to do is to instill fear in people so that they don't take the vaccine. So thank you, Doctor, for what you said. It's not the mark of the beast.
Okay, wonderful. Does any other panelists want to add any more to that? Because I wanted to follow on that question with, does it change my DNA? That's the next question.
Yeah, I'd like to add a little bit to that, and I agree with what everyone has said already, but I also want to say that some of the reasons, and this is anecdotal, by the way, because there's no research behind this, why people started to talk about mark of the beast and this was global. This was fear-inducing, and it was actually quite discombobulating for most of us, apart from just people in the public, but even for us in healthcare. It was something that we'd never seen before in our lifetime. So I would like to be respectful of people who started to feel that way, that yes, your fear was justified. However, I think there were quite a few people that capitalized on this fear and started to produce information that actually heightened the fear and gave them more views on YouTube or on Facebook, which translates to money. So all of this, as I said, is anecdotal, but I'm just saying that some of the fear about 666 and mark of the beast and luciferase and the enzymes, we've been sort of cobbled together to try and get this excitement going and earn some people money. And it doesn't change your DNA, because I will struggle to see how that would happen. It doesn't even get to your DNA. This is messenger RNA, and it's meant to produce the protein, imitate the protein on the SARS-CoV-2 virus, so that when you do get the actual virus, then you can react to it. So it has nothing to do with your DNA in any form at all. So the answer is no to your DNA changes. Yeah.
Okay. So what you're saying is, with the DNA question, there is definitely no change at all to the DNA structure.
There is definitely no change at all to the DNA. It has nothing to do with your DNA. It's a messenger RNA, which helps you to produce protein anyway all across the body, and this is targeted towards COVID in this particular instance, to produce that spike protein, so that when you actually come in contact with the real thing, you can fight it.
And so what happens to that mRNA? What happens to the mRNA then once you've had the vaccine? Does that stay in our body? That's the follow-on question.
It just dissipates. It disappears. Once it's done this job, the job is a messenger, as I say. That's why it's called messenger RNA. It's been sent to do a job, and once the job is done, that's it. It's finished.
Okay. Thank you. So I guess that then just gets absorbed up in the body, and the body does what it should do in terms of getting rid of it, but it would have done what it should do in the body. Thank you so much for that. Now I'm going to ask, there's one more sort of conspiracy theory that I wanted to put forward, which was more to do with the religious leaders. And I think that Professor Jaisimi already touched on this. Well, the question was, my faith leaders advised that this is not something that we should take. How do you think we should deal with this, or how should we respond to this? So our faith leaders said we shouldn't take the vaccine.
I will come into the discussion at this point in time. I think as healthcare professionals, as citizens of the world, at the beginning of the webinar, I said it's okay to have concern. I think we should try and avoid the use of anti-vaxxers. We should try and avoid the use of conspiracy theories, even if they are that. But let's address the issues without emotional terms. I think when we play to their gallery, then that's where they get more fuel to it. So rather than say hesitancy, it's reluctance to take or uptake in terms of uptake. People don't like the word "had to reach BAME community." What do you mean "had to reach BAME community"? How much effort have you made to get to the BAME community? So that's just a different aspect. But when it comes to the conspiracy theory about what pastors say, I'm a Christian, but I've also spoken to people of other faiths, Muslims. The mosques are being opened as vaccination centers. The Jewish temples are opening up their temples of vaccination. There's nowhere that it says that God said we shouldn't take vaccine. So when a religious minister says, don't take the vaccine, the Bible says, get wisdom. You should have a discerning spirit. It says in the latter days you're going to have false prophets. So because somebody stands in front of you and says you should not take the vaccine, what today's exercise is about is to give you the pros and the cons, so that you as an individual will make an informed decision. We are not saying take it. We are saying this is the reason why we think it's valuable. If any pastor is going to say don't take it, they have to tell the congregation what's the alternative. Is it just praying? It says faith without work. If you pray and pray without work, then it's dead. And what I'm going to say is this. Perhaps it's going to come later on. Because I have a little bit of legal background, what we call vicarious liability. If a pastor can stand in front of the congregation and say, I'm telling you not to take the vaccine, and I guarantee you that if any one of you in my congregation gets the infection, you can sue me, then I'll believe them. But I don't think there will be any pastor who can stand in front of their congregation and say, I'm telling you from the word of God as a man of God that you should not take it. And if you take it, no, you're not going to get it. But if you get it, you can sue me. No, it's not going to happen. So I think as individuals, as members of the public, we've got to listen. Not everything you see on social media, on Google, even on television is correct or is true. Let us have that discerning spirit. Let us have that conversation, which is what we're having today. You've asked me a number of questions. I've said I don't know the answer, and that kind of thing. Let's be honest in our communication. That is what I would say from the religious point of view.
Okay, Dr. Oyenkero, you're raising up your hands there.
Yes. Thank you so much. And thank you, Prof. Jessamy. You've touched on quite a number of very important points about, pastors and responsibility. I think all of us, and most Black people, most Africans, most Nigerians are people of faith of some sort or another. However, what I also think is that there are two ways by which you can look at it. One is that God has given us wisdom, and science is part of the wisdom He has given us. So if we have a pandemic and we have the wisdom that God has given us to help fight this, then why would you not come forward? Why would you not use the God-given wisdom, that God has given to give us tools? Why would you not use that to be able to protect yourself and your family? So that's one thing. On the other hand, too, what I also think is, responsibility. Where does your responsibility lie? Ultimately, we go to church or we go to the mosque. Most of us go to churches, and we're talking about pastors here. We go to church and we listen to a sermon, and we go home. What happens in our home belongs to us. That your pastor is not going to come and and help you make your bed or cook your food. If God forbid, either you or your loved one dies or becomes seriously ill from COVID, that's your cross to bear. Your pastor, we bless him. He's not going to come and take, he's not going to come and take on your responsibility. He's not going to come and take on, he's not going to come into your house. So I would really, really urge people, this is a decision for you and your family. If you're a woman here and you've got a husband and he's worried, talk to him about it. If you're a man and you've got a wife and who's worried about it, ultimately, if you have children, and the sad thing about it is that we have heard so many stories. I mean, they're not stories. This is the news that's coming out about families where husbands and wives have died from COVID. So, and these are people who, and we, like I said, we know that in the African community, we are in some ways, if my uncle used to call it, we are insurance for our families. If you're of that working age, you are the insurance for your elderly parents, because without you, they need you to be able to survive. Almost everybody sends money home at some point, or to relatives, and then you're the insurance for your own children coming forward. So if you're not there, that is a disaster. It's a disaster for that family. So please, this is a personal decision. The science is there. God has given us wisdom. I mean, the Bible has so many instances where God, actually so I was just reading John, and what did he do? He took a little bit of mud and put it on the eyes, and then the guy was able to speak. So God has given us wisdom. Why would we not use it? Let us use wisdom to help ourselves. So please, ultimately, the responsibility lies with each individual. Even if your pastor says, well, I'll train your children, why would you not want to be able to at least do your best to protect yourself for your own children or for your own elderly parent? So please step forward. There isn't, your pastors are not offering you an alternative. What is the alternative? We have had too many of our people die, and I'm passionate about this because I think it's unnecessary. If you can protect yourself, why would you not? So please, I just really, really encourage you to take personal responsibility for yourself. Thank you.
Wonderful. Thank you so much. I mean, the conclusion from all of that is that, yes, we should take all the information that we're being given, weigh it all up, and make an informed decision about whether or not we should take the COVID vaccine. Just setting the room again, we're in the question and answer session, AfroGPHertsandBeds event today, which is on COVID-19 concerns. I've got a question for Dr. Alozie, who's one of our speakers. Is there any further information on the drop in infection rates in places like notably India, China, the places that seem to have gone back to, well, almost normal, while we're still sort of trying to battle through the pandemic here? What are they doing differently?
Yeah, well, I'd say India and China are two very different countries, right? So I think the demographics or the epidemiology of the pandemic in China very different. I mean, again, it may have originated there, but they took some immense steps to curtail and control the spread. And so I think let's take China off the table. In terms of India, at various points in time in 2020, they had with Brazil and the United States some of the highest per capita rates of infection. But I think what India has done immensely well, and talking to colleagues that have gone there multiple times in 2020 to work on the pandemic in India, is sort of they slowed the country down at a point in time. They had a lot of death and they struggled through that. And then at the same time, they've been also very stringent and strict at various times around non-pharmacological interventions, right? So it's hard in India because there's a billion people. And so you're not going to get physical distancing in India, just like you're not going to get physical distancing in Lagos. But again, at the same time, I think what we've seen is that in some of these countries that have a very young demographic or they're heavily weighted in their under 40s, this pandemic has not affected them as much. And I'll tell you anecdotally with some colleagues that went to Nigeria, the eastern part of Nigeria over the holidays, and they tested over 1,000 people in their various villages. It was antibody testing. And again, this is anecdotal. I've told them they should publish it, but 63% on average of their villages were positive. So if that's even halfway right, and they had a 30% exposure rate over December, that would explain immensely why we haven't seen the ravages of death, like Dr. Jessamy mentioned, in a lot of these countries. The people are just too young. And we know that this is a disease of people that are older on average. We know that this is a disease of people who have multiple comorbidities. And that's just not what exists in a lot of these countries.
Fantastic. Thank you so much for answering that. I've also got another question. Again, this is around cancer treatment. So what would you advise someone that's going to have chemo? Would you advise them to have the vaccine the day before chemo? So they're asking, is it safe to have the vaccine the day before they start their chemotherapy?
I mean, I'm assuming that's for me, but I'll take it even if it's not. Again, here's the guidance that we would give, right? If you're in the middle of chemotherapy, that's not the time to get this vaccine, right? I mean, and that's just sort of medical common sense. There's very few things that we will tell somebody that's starting chemo on Monday to do on Sunday. That's an injection and an infusion, or could potentially change any of their sort of internal balance, right? I think the better part of valor, or was it mean better part of valor, would be their cancer doctor, their oncologist, should have had an open conversation with them about the timing of their chemotherapy, and ideally gotten them the vaccine before they started chemotherapy, right? I mean, we're in March. Tomorrow's March 1st. Happy March. And I think if the oncologist has not been having that conversation with them, they need to potentially find a different oncologist. But that should have been the conversation they had prior to starting chemotherapy on Monday.
Fantastic. I mean, Dr. Alabi, would you like to add any more to that? I mean, I guess, obviously for us, because we work in GP land, so family physicians, we get a lot of questions around, should I have it? When should I have it? And we're getting this not only from Black people, but from everybody asking questions. Oh, I feel really unwell today. Should I have the vaccination? And there's a lot of guidance on this, but people don't seem to know where to find them. So could you guide us on where we can find information as such, and also just give us a little bit of nuggets on how to deal with this? Thank you.
Yeah, I think the information is really out there for the UK with the Green Book. So if you go on to chapter 14A, just put that on Google. It has all the caveats on there. Clearly, if you're going through cancer treatment, you're clearly immunosuppressed. So I think what's been happening here, you're advised to have the vaccine 2 weeks before your next course. So that's the best way. But if you have a fever, then we wouldn't advise you to. One of the questions we ask is, do you have a fever? If it's yes, you're out. When your fever subsides, then you come back. So if you're acutely unwell on the day, then we don't advise you to have it on the day if you have a flu or if you have a fever. But apart from that, really, there's no reason why you can't have it. So if you have specific conditions for which you're under a specialist for, There might be little tweaks here and there, but we're very proactive in the UK. So your nurse, your specialist nurse, your consultant would have had a conversation with you. And as the doctor said, if they haven't, then really you should be complaining. They would have had that conversation with you. So please go ahead and have it, unless you have those issues.
Fantastic. And I guess also just to sort of buttress that point is that with the COVID vaccine, you might have very slight flu-like symptoms after the vaccination. So I think if you're starting new treatment that's sort of conflicting with the vaccination, then it's difficult to know what's causing what. And we like to have a clear, distinction between one thing and the other so we can know how to best deal with side effects that you might be having from any treatment that you're experiencing. So it's usually best to have the vaccination when you're well. And that's why we stress about the temperature, checking that you're feeling well in yourself before you go ahead and have the vaccination. We're coming very close to the end of our session today, and I'd like to give our panelists an opportunity to just summarize quickly, again, your thoughts on why our audience should consider taking the vaccination. But before that, I'll be asking the last question, which I've got. So I think I've pretty much covered all the questions that have been asked today. If you feel like your question hasn't been answered, if we've missed out your question, please drop your question into the chat right now so that we can go over it and answer it. But the last question I have here says, assuming 95% of any population take the vaccine, will that population stop wearing face masks and mix together in high numbers, as was the case before the pandemic? So would we return back to how we were doing things normally before the pandemic if we've had 95% uptake of the vaccination? Who would like to answer that question?
I'm happy to. If anybody wants to jump in, please feel free to. No, I don't believe that there's an immediacy to stopping the plan. It's a multifaceted plan, which is the vaccine is one of it, and then we still have washing our hands, giving each other space, and what's the other one? Hand space, yeah. So covering your face. So there's no plan to stop that, even if everyone has a vaccine, until we see that levels have gone completely down in the community, and we're not seeing any cases for quite a while. So this is a marathon. It's not a sprint. So we are going to have to be wearing our masks for a while. And to be honest, I think it's kind of a good thing, because some of us as GPs here, many of us have got ill in the past for people coughing in our faces. So actually, I think it's still a good thing. So there's no plan for us to stop any of that for now.
Okay. Thank you so much, Dr. Alabi. Does anybody else want to add any more to that?
Yes, I just wanted to add to that. So thank you so much. Yes. Another thing really is that, even in the best of times, vaccination uptake for most campaigns is usually about 70%, when it's really good. The COVID vaccine so far across the UK is almost, for those who have offered is up to 93% uptake. In the BME, so those who are Black and African, our uptake so far has been about 56%. So we're still far behind the uptake for our white counterparts. And we're hoping that things like this will encourage people to come forward. But we do know that the more we have the vaccine, and the more we see the numbers changing, the more likely we are then to be able to go back to normal life. Like my colleague said, what we want to see are our numbers coming down. We want to see reduced transmission, hospital rates coming down, and the likelihood going forward is that if or rather, let me say, one of the concerns about not taking the vaccine is that if we as a community, that's as Black people, as Africans, say, look, we don't take the vaccine, what then tends to happen is or the worry is that we may then become little hotspots of infection. So our communities just continue to propagate the infection, and that really doesn't serve us as Black people, and it doesn't serve the health system either, because then what we don't want is a situation where COVID becomes a Black disease, because we are so afraid of not coming forward to take the vaccination. So once we're hoping that if we are able to allay your fears and answer your questions, and of course we see the evidence as we are seeing every day on the news in terms of the numbers, the hospitalizations, the deaths, all of those numbers are really improving. They're going in the right way. So if we as Africans, and Blacks can come in and, do our own part to protect ourselves, because ultimately that's what we're doing. We're protecting ourselves and we're protecting our communities. So once we are able to do that, then, yes, we're hoping that we in due course, and with a public health hat on my head, probably by, sort of midsummer, late September, when people have had both the first and the second vaccines, then we should be able to have a lot more interaction. But if, for example, you live in an area where you have a high Black community and you have high COVID rates because people are worried about taking it, then, that mixing is not going to happen, so it is important for us to protect ourselves and protect our communities, because even if we might not have severe symptoms, if you're younger, but that doesn't mean that you can't spread it, Yes, if you have the modeling for a cough or a sneeze, it travels about 6 meters, or 2 feet. So, your cough, your talk, your singing, your churches won't open, your mosques won't open, your schools will be shut, so we really need to, look at how we look at not just ourselves as individuals, but the communities in which we live. So we're hoping that, as we take up the vaccine and as the infection rates come down, then yes, we will be able to engage better. Thank you.
Thank you so much, Dr. Ng.
I'll say as the renegade American, if we get to 95%, masks are gone and we're returning to normal life. That's just the sort of line in the sand. Again, there's nothing in life that's a zero risk equation.
That's right.
There was nothing in life before COVID that was zero risk. We all took risks driving, getting on planes, engaging in the hospital. As an infectious disease person that's done HIV research for over 20 years and has drawn blood on my patients for the greater part of that 20 years, we take risks with that. And so this is not a zero risk game. It's not life, and that's not reality. If we get to 95%, life returns to normal. By this summer, in many parts of the country, in the United States and across the world, at 50 and 60%, you will be surprised how it will feel like a renaissance of Woodstock in many of these countries. So those of you that are involved in stock or investments and want to go buy Carnival and airlines and all those resorts, start buying now, because people are going whether or not. What Pearl said, though, is crucially important. This cannot be a Black disease. This cannot become an African disease. If that happens, we have failed ourselves across the board. But there's no reasonable, I think, look at vaccines and how these vaccines are working and the reduction in transmission by up to 75% in some cases that will tell us, even if we get to 60 or 70%, that a large part of people will not return to normal.
Fantastic. Thank you so much. Professor Jaisimi, do you have any more, just a few more things? I'm going to round up now. I need to hand over to Dr. Charles Esene to just sort of bring this together.
Yes, I re-echo what Dr. Olove has said. If we get the herd in unity, then life will get back to normal. There will come a time when we wouldn't have to be wearing masks. But Japanese and Chinese people have been wearing masks even before the pandemic. But we'll leave that for another day. One brief item I want to address is the issue of the vaccine passport. If any country legislates that before you come into their country, you should show evidence that you've had your COVID vaccine, then they have a right to do that. This is a public health issue. It's not just about you, but it's about protecting the other people. Yes, you've got your human rights. Traveling into somebody else's country is not a human right. So people are now talking about, they are going to bring in the vaccine, the COVID vaccine passport. There's the international disease yellow card passport that's been in existence for years. Yellow fever, cholera, so it's not a new thing. So again, and I think the media has also a role to play in this. When you start playing to the fear of, before you get into a pub, you need to show a passport that you've been vaccinated. It's about protecting ourselves and protecting others. So my passing word will be, in everything, let's get wisdom. Let's take care of ourselves. We've lost too many people, uh, and the virus is real. People who say it isn't real, it is real. People who have lost loved ones, as a group of all of us here today, I think I can say on behalf, we express our sympathy to families that have lost loved ones. Those who have had the disease and still suffering from it, we empathize with you. This disease is real. And thank you once again for the opportunity you've given me to share my experience.
Wonderful. Thank you, everyone. We've had such an interesting, very stimulating session. Wonderful questions have come through. Like I said, we're recording this, so we will be putting this up on our YouTube channel, and snippets of it will also be going on the Instagram page. I'm going to hand over now to Dr. Charles Ezene, is the chair of AfroGPHertsandBeds. It will just be sharing a few words with us. Thank you, everyone.
Thank you very much, Shay, and I would like to say a big thank you to everybody who has joined us today, especially our panelists who have shared their experience with us. All the questions that have been asked have been, I think, have been well answered, so thank you very much for coming. And to all the people who have joined, I would like to say a big thank you to you. I think when you go to school, at times when you're going home, you get an assignment. So we will want to give you an assignment to go home with. We understand your concerns about the vaccine, which is why we've addressed this as concerns and not myths. And we also understand that there are underlying issues that will make you start to think the way you think. And we've addressed some of them today, which include our culture, religion, and I think more importantly, the lack of trust in the system where we find ourselves. And what is happening is we're finding that the anti-vaxxers are using the culture, religion, and the mistrust as fertilizers for them to spread what they're spreading. And at the end of the day, what will happen is that this disease will become a black disease. And the health inequalities that we're already experiencing will become worse. So the essence of these conversations that we're having is to start to build up a momentum so that we don't lag behind. We don't continue to lag behind. And when it comes to vaccine passport, I'll just quickly add, we all have been asked to now start downloading the NHS app. If you've had your vaccine, it will automatically pop up in your NHS app, which means we already have a vaccine passport. So that's going to happen. But I'd like to say a big thank you to everybody who's joined us today. We will be doing more of this, where we'll be looking at the faith groups, trying to get our faith leaders involved in our conversation, and also doing for other communities as well. Thank you very much, everybody, for your time today.